got a lot of responses about my hair stem therapy, and so I wanted to talk a little bit about it so people understand what it is, how I do it, and what are the dynamics of it. So the best context of understanding this is thinking about what's PRP, or platelet-rich plasma. PRP is, as most of you already know, it's blood drawn from your body and then spun down and processed and purified in order to be re-injected into the scalp to help assist with hair growth. It's also used for orthopedic joint healing and various other things. People also have used it for skin rejuvenation in terms of what they call the vampire facelift. I have tried it for skin. I honestly think it's an absolute abject failure. I still use it, just use it today in context of doing a hair transplant. So when the person's getting a hair transplant, I still harvest PRP, harvest blood, and process PRP for the scalp. However, I don't believe PRP to me today is the state-of-the-art way of managing hair loss in a non-surgical fashion when someone comes to my office and wants to restore hair. I've now moved on to what I would call PRP 2.0, which I call hair stem. So essentially what this therapy is if you are a menopausal or perimenopausal female and you're contemplating or undergoing hormone replacement therapy, you'll understand what I'm doing, because back in the 1990s, conjugated equine hormone therapy was the standard, and now something called bioidentical or biomimetic therapy using plant synthesized growth factors or hormones. So essentially that's what I'm doing, is instead of using your own native growth factors, I'm using plant-derived growth factors that are synthesized. And the benefit of plant-derived growth factors is several-fold. One is molecularly identical to what you have. It's all natural. And it's also abundant, so that I can actually use a much higher concentration than what is in your own blood. And also, there's no pain, so I don't need to draw your blood. I don't need to re-inject it. I also have a $25,000 machine that infuses these growth factors into the scalp. So for me, there are three distinct advantages of this therapy over conventional PRP. The first of all is that there is absolutely no pain. So it takes about 90 minutes to do this procedure, and the benefit is, since there are no needles, you do not feel any injection. And I will tell you, for me, a big component of ongoing therapy is to be able to give patients compliance, or make compliance easier, that is. So if something is painful, I will tell you, you will stop doing it. It's human nature. So if I can make it 100% painless, that makes a huge difference. And we are all very busy people. So making it also no recovery or no hair shedding is huge. Women in particular are much more prone to hair shedding than men. And so if I'm injecting it with needles, there's going to be a higher chance of temporary hair shedding. No female wants to hear that. Men can also be sensitive to that. So we can avoid needles. We avoid recovery, bruising, swelling, pain, and also any kind of hair shedding, although that's theoretically always possible. And the final one, which is to me very, very important, is efficacy. I've only had one failure, and that failure actually was a lady that, when I went in to look at her, she had traction alopecia, which is a permanent hair loss that is not amenable to hair stem. Of course, you may not respond as well as you would like, but in general, the response is much more consistent and much better than standard conventional PRP. So much higher efficacy and also much faster results. I oftentimes see results within the first 1 to 2 rounds of therapy, much more dramatic than what PRP was offering in the past. The therapy takes about 90 minutes. I do not perform it myself. My staff do it. And you would do it once a month for 3 months and then maintain it every 6 months. So easy therapy, and I will give you a brief understanding of how and when I offer it. To whom do I think it is actually worthwhile? So for women, if you listen to my long podcast, about 17 to 18 minutes long, about female hair loss evaluation, I find that most women actually respond quite well on the natural side of things. They don't necessarily need to have finasteride minoxidil. Sometimes I do believe they need both. Sometimes I do use finasteride minoxidil. Vast majority of women do incredibly well with hair stem. If they're dealing with hair shedding, hair progression, they do very, very well as a standalone treatment. My other therapy, though, and I have a bias toward it because I developed it over the last 2 to 3 years, is something called FolliFlow, Folli, FLO. It's found on Amazon. It's also available in my office. It's also a plant-based, all-natural spray. It is wonderful in terms of stopping hair shedding in its tracks, incredibly fast. To me, it's even better than hair stem, and it's better than minoxidil and finasteride, which can also actually cause hair shedding, which is not a bad thing. But my product is incredible, the FolliFlow. I had my au pair who lives with my wife and me had Roombas filled with hair, and within less than a week, all the Roombas were gone. There's no more hair. My FolliFlow is incredibly potent, and you'll know it faster than what a hair stem will deliver, and certainly much faster than finasteride minoxidil. So for women, hair stem is my gold standard for the most part, and if I'm dealing with chronic thinning and hair shedding. But hair shedding, I would use FolliFlow in conjunction, or even just as standalone. If I'm dealing with a female with acute hair shedding, my go-to is FolliFlow. If someone is having, postmenopausal, there's definitely some frontal temporal recession, and it's something that's slightly on more of the mid to acute chronic phase, I will probably use finasteride minoxidil as needed. If someone's got really stable hair loss, especially for women, my go-to may just be a standalone surgery, and so that's the complexity of the consultation. That's why it takes years of judgment to make a decision that would be ethical and appropriate for you. For men, hair stem is not usually my go-to. My usual go-to for men is finasteride minoxidil, because I believe the biochemical profile of male pattern hair loss is so strong with DHT as a hormone causing hair loss that I simply do not believe that hair stem is sufficient. There are some exceptions. So the first exception would be someone maybe in their mid-50s. They don't want to do, I just saw a gentleman this week, in fact, that may not be ready for hair surgery. For me, actually, my go-to for him was actually just standalone surgery with almost no medicine, which is rare that I say that. But in general, for men, my biochemical therapy is my go-to. This serves as a backup. So if you look at the age spectrum, if men are on the older side and they don't want surgery, for example, this could be my standalone therapy for them. For my younger men, so my men in their maybe, let's say, I'm talking very broadly, so please understand that when I come to you, don't listen to this video and say, well, how come you offered me something slightly different? Because it's a contextual basis that I have to give you. So if you're in your 30s and 40s, I may just say, look, you don't need the hair stem, let's just do some biochemical therapy, and we may or may not have surgery based on your safety. For my younger men, in their 20s, unfortunately, I know it adds expense to the equation, and they usually cannot afford both the biochemical therapy and the hair stem, but I am pouring everything I can at you, and I would love for you to be on both biochemical blockade as well as hair stem. So those are very generic, broad sweeping comments about men and women bracketed based on some criteria that I will probably address with you, and those are how my decision algorithm works in terms of deciding your candidacy for this treatment. So hopefully this concept of the hair stem and how I use it in you based on your gender and your age and degree of hair loss and what's going on with or without biochemical therapy, with or without FolliFlow, makes some sense to you.